Alright, so we have some questions here. Yeah, like that's like a group of exam questions. And you guys to see that this group of exam question was kind of like tilted towards us talking about medial medullary syndrome. Okay, so the main question was this. It was quite long. All right, I get to see that medial medullary syndrome is still what we call the Dejerine syndrome. All right. So here they describe the medial medullary syndrome before starting to talk about it. So they said that it actually refers to a condition in which a patient has a spasticity and diminished proprioception and tactile sensation on one side of the body, combined with weakness and atrophy of the contralateral side of the tongue. All right. So they are now asking you one or two questions about this. The first one is they said that in medial medullary syndrome, which way would your tongue be deviated? I have tongue deviation, so which side will the tongue be deviated at? Then the other one they said that what structures would have been damaged to account for what these findings that we have in medial medullary syndrome. Then occlusion of which artery or arteries will actually cause the syndrome. Alright. So here I'm talking about the direction of deviation. We said that when the tongue is protruded in a patient that has medial medullary syndrome, it will deviate towards the side of the lesion. So this happens because the hypoglossal nerve, that's cranial nerve 12, right? This hypoglossal nerve controls the tongue, so it is affected on the same side as the lesion, and this will lead to what? Weakness and atrophy of the muscles on that same side. Okay, so if it is protruding on the left, that means the lesion is on the left. Protruding on the right shows that the lesion is on the right. Okay, then what damage structures would actually account for this medial medullary syndrome? So we said that the structures that would have been damaged to account for the findings in medial medullary syndrome include what? We have the medial lemniscus. All right, medial lemniscus. You see this area that has been shedded, right? The area that has been shedded that looks like a gun. Okay, it shows all the structures that have been damaged. So medial lemniscus is one of the structures that have been damaged. So if medial lemniscus is damaged now, it results into what? Diminished proprioception and tactile sensation on the contralateral side of the body. Right. Then we have the corticospinal tract. Corticospinal tract. All right. Corticospinal tract. It will cause what? Spasticity and weakness of the contralateral side of the body. Then we have the hypoglossal nerve. Right here is showing hypoglossal nucleus, but the nerve actually like comes out from there, okay, to supply muscles of the tongue. So the hypoglossal nerve is damaged. It will lead to what? Weakness and atrophy of the tongue on that ipsilateral side, that's on the same side. Okay, so this one is contralateral. That means if it happens on the left, the effect will be felt on the right. But for the hypoglossal one now, if it happens on that same side, the effect will still be felt on that same side. Okay, so which artery is likely to be occluded for this medial medullary syndrome? Of course, you see it here, the anterior spinal artery. Alright, so the most likely artery to be occluded is what? Anterior spinal artery. So this artery supplies the medial part of the medullary oblongata. So its occlusion leads to what? Infarction of the medial medulla. Okay, I think basically that's it. Talking about the medial medullary syndrome, focusing on the arteries affected, the side on which tongue will be deviated at, and then talking about the structures that will be damaged for medial medullary syndrome to occur.